I'll give you an example. I had a patient that came in not too long ago, and she's had a history of sciatic leg pain for on and off for 17 years. Think about that for a moment. 17 years of leg pain on and off down the leg that caused disability on and off over the years. And finally, she comes to an office like ours where we do corrective care for the spine and posture. And what we did differently, as she said, is we actually analyzed the spine properly, took x-rays, and then we began to correct the distortions and the subluxations and misalignments that. In this video, I'm going to answer specifically how do I get rid of or how do I stop my sciatic pain from hurting. So before I get into that, there's a couple things that I really want people to know. As a chiropractor, I'm a corrective care chiropractor. I'm located here in Vaughan, Ontario, Canada. And our work is basically focuses on correcting structural distortions on the spine that interfere with nervous system and cause disability, whether it's limited mobility, whether it's chronic pains, degeneration on the spines. And these all have big, massive consequences when it comes to health status. And if you're new to my channel, be sure to click on that subscribe button and the notification bell so you get notifications on all my new videos that come out weekly, so you know how to relieve pain, conquer stress, supercharge your health naturally, safely, and effectively. So by the time someone comes to an office like ours, they've already been through the ringer. They've had MRI reports, they've had CAT scan reports, they've had pain injections, they've had therapies, they've been to specialists. Unfortunately, they leave something like corrective chiropractic care as a last resort. So we've helped tons of people with conditions related to the spine, things like sciatica, things like disc bulges, degenerative changes on the spine, neck pains, upper back pains, headaches, things and symptoms and disabilities that relate to spinal troubles and spinal misalignments. So sciatica tends to be a very, very common problem. And I want to answer a bunch of questions related to sciatica. So this one here is how to stop the sciatic pain from hurting. So before I get into that, let me just show you here, and it may be backwards, I'm not sure, but this is a poster. So you'll see this is the sciatic nerve right there. So it emerges from the gluteal area into the thigh and branches out into the legs and goes right to the foot. But the sciatic nerve is actually composed of a bundle of nerves that emerge from the lower lumbar spine and the sacral region, right? So it's a bunch of nerves. So sometimes the sciatic pain can actually be coming from the gluteal area, the piriformis area, and it triggers a true sciatic pain that goes down the foot, down the leg and the foot. It can be leg pain, it can be numbing, tingling sensation, it can be shooting, stabbing pain down the leg. But most of the time I find that leg pain is not a true sciatica. Most of the time what happens is the actual source of the pain is coming from the nerves of the lower lumbar spine. So the best way that I know to help sciatica and stop sciatica from hurting is to get a proper correction of any bony distortions or misalignments or structural distortions in that lower lumbar spine, because the spine normally should be straight from top to bottom and should have a natural elliptical curve from the side. And that's the best position for the spine to absorb the loads based on gravity, because we're standing up as human beings. So it's the best position to absorb the loads based on gravity and to distribute those loads evenly. So the disc and the spine is positioned a certain way to be able to adapt to our daily stresses and daily loads. But when the spine is shifted out of position and distorted out of position, and now it begins to offset the loads to one way or another, then now begins to break down the connective tissues and the supporting tissue of the spine, whether it's discs, whether it's ligaments, whether it's the bones themselves begin to become degenerated. And this can begin to irritate the supporting structures around the spine. So joints, ligaments, discs, muscles, tendons, and especially in that sacral region, the sacroiliac region. So right over here, this sacral iliac region right there, that can actually cause a tremendous amount of irritation, inflammation, and cause referral pain down the back of the thigh. And sometimes I can go down the back of the thigh to the knee, and people call that sciatica. That's not true sciatica. That's sciatica-like pain that's coming from the supporting structures of the lower back sacral region. But at the same time, it's debilitating. And sometimes can even refer down to the bottom of the leg if it's triggering a nerve that comes from the lower lumbar spine. So the whole thing about this is that if there's a sciatic pain, sciatica-like pain, nerve pain that goes down the back of the leg, or referral pain that goes back down the back of the leg, don't let this become a chronic problem. I'll give you an example. I had a patient that came in not too long ago, and she's had a history of sciatic leg pain for on and off for 17 years. Think about that for a moment. 17 years of leg pain on and off down the leg that caused disability on and off over the years. And finally, she comes to an office like ours where we do corrective care for the spine and posture. And what we did differently, as she said, is we actually analyzed the spine properly, took x-rays, and then we began to correct the distortions and the subluxations and misalignments that are hurting, is by doing a proper checkup and a proper examination of the structures of the spine. Not just the muscles, but the bony structures and bony alignment of the spine. And then following through the proper corrective protocol to correct those structures that are irritating the nerves that contribute to the leg pain. That's key, and that's what's missed most of the time. You cannot get a proper corrective path or corrective recommendation or corrective protocol if it's not properly examined from the first place. So that is super important. And there may be some things that can help relieve sciatic pain, like the stretches that I'll put up here in the card later on and in the description below. These things are helpful, but in order to truly resolve it on a more permanent basis, it needs to be literally checked by a professional. And in my opinion, there's no other better professional to get it checked by than a chiropractor. And if you can find a corrective care chiropractor, that's even better. And if you need help finding a corrective care chiropractor in your city, let me know. I have access to a wide variety of colleagues throughout Canada, the United States, some that I personally know and some that I can refer to a database of corrective care chiropractors that can do some really good work if that's what you're looking for. So sometimes people ask me, what should I do? And I ask, well, what have you done so far? And many people haven't done much therapy when it comes to correcting their chronic ailments. So they need to get some kind of professional assessment and then get it corrected properly. And that makes a massive, massive difference. That lady I was telling you about earlier, within 3 months, she started walking better, her pain decreased, she was happier, and her spine function and position began to improve. And that's with applying corrective chiropractic techniques based on the examination that we've done. So I hope you found this useful. Let me know in the comments below. I really want some feedback. I do have a list of about 21 commonly asked questions related to sciatica. I don't know how many I'll get through in this series, but look out for this series. It's going to be entirely on sciatica. I'll try to get them out as regular as I can. There'll be a playlist. And if you have any questions, I'll do my best to answer questions. Most time I reply back to the comments when I can. I have literally 1,000 comments, over 1,000 comments in my queue, so it's hard to get to all of them. So I do my best. And sometimes what I'll do is I actually make videos to answer frequently asked questions as well. So look out for those as well. If you like that, click the thumbs up. Let me know the kind of things you're looking for, because I truly feed off on feedback. If there's something that you're not happy with, let me know as well, because it helps me get better at what I'm doing to provide better content to our community. And the best way to know about these videos is to click that subscribe button, hit the notification bell, and of course, there might be someone out there that could use this information, so really share it with them. I hope you enjoyed this. This is Dr. Walter Salubro. I'm from Vaughan, Ontario, Canada right now. I literally just finished my day and I'm about to go home and see my family, and I'm looking forward to that. So I'll catch you on the next video. Thanks for watching. To learn more about how corrective chiropractic care at Back to Health Chiropractic Center can help you with your chronic pain problem, visit www.ibthcc.com. Back to Health Chiropractic Center is located at 20 Cranston Park Avenue, number 6, Vaughan, Ontario, L6A2W2.